Good afternoon, everyone. Sadia, am I audible?
Yes.
Thank you. Good evening, actually. Good evening, everyone, and welcome to the Sphere India COVID-19 Academy. Sphere India, in collaboration with UNICEF, WHO India, HCL Foundation, and NIDM, launched the COVID-19 Academy in April with the aim to build capacities of frontline workers, volunteers, and outreach workers for COVID-19 preparedness and response. Today is our 62nd session, and today's session will be on risk communication and community engagement during COVID-19. Depending on the characteristics of the novel coronavirus and the setting in which the infection occurs, there are direct health implications as well as the risk of secondary morbidity, mortality, disruption of basic services, impact on the economy and livelihoods, and the new increased protection needs, some of which may stem from the fear due to an unknown pathogen and signifying the importance of appropriate risk communication and engagement, community engagement. RCCE is one of the priority areas of Ministry of Health and Family Welfare to respond to the COVID-19 outbreak, to inform decision-making related to personal risk, mitigate rumors, share information and advice between experts, communities, and officials, and to effectively involve communities in the response to control the outbreak. The purpose of this session is to strengthen the knowledge and enhance understanding of participants on risk communication and community engagement, especially in the context of COVID-19. For this, today we have with us very eminent resource persons. We have Dr. Ritu Singh Chauhan from WHO India and Mr. Elnoor from UNICEF India. I will take a brief moment to introduce and welcome both our resource persons. Dr. Ritu is an international health expert with 15 years of experience in WHO, working in policy, strategy and planning, program evaluation, capacity building, strategic risk communication for preparedness, and response to outbreaks, public health emergencies, particularly for high threat pathogens and business continuity planning. Some of the public health emergencies where she provided technical guidance for country preparedness and response include pandemic influenza AH1N1 2009, Ebola virus disease West Africa, UN post-disaster assessments following Kerala floods and Cyclone Fani in Odisha, Nipah in Kerala, and presently supporting the COVID-19 response in India. Next, I would like to introduce Mr. Elnoor, who is a communication for development specialist at UNICEF India. He is a national of Azerbaijan, and started his career as a reporter with National State TV and Radio Broadcasting Company in 1995. In 1997, he joined the International Rescue Committee managing community development programs, and with Relief International and UNHCR managing education programs. In 2002, he joined UNICEF Azerbaijan as Public Relations Officer under World Bank funded primary healthcare program. Since 2005, he has worked in the capacity of C4D specialist and served in various UNICEF offices, including Zambia, Georgia, Jordan, Kosovo, and most recently Malawi. He holds an MA on linguistics, social linguistics to be more specific, and completed academic learning courses with New York University and Ohio University. With that, I welcome Dr. Ritu and Mr. Elnoor for taking the time out and being a part of this very, very important session. I would now like to hand this over to Dr. Ritu to take the session ahead. Thank you.
Thank you, Valerie, and a very good evening to everyone. And today, as Valerie has described, Valerie, firstly, thank you for the very kind introduction. And it is our pleasure to be associated with COVID Academy. It's wonderful to hear that we have completed over 60 sessions. So many congratulations and kudos to Team Sphere India and all the partners who have been part of this whole venture. I think we have been able to galvanize and build some strength into it, and we will be reaching out to many, many more people than we would have done otherwise. So congratulations for that. Over to today's session, friends. Welcome everybody from, we extend our greetings from the World Health Organization. As you know, this is a very unprecedented pandemic. And we are seeing a lot of social dimensions also about this disease. Today, we will attempt to understand how risk can be communicated and should be communicated about COVID-19. What are some of the strategies which should be followed and what the global agencies recommend? And then finally, what are some of the challenges that we are finding in terms of communicating the risk? How can we do better? What are some of the things that we need to be cognizant of? So I will start with sharing my presentation. Valerie, do you have my slides? Just let me see.
Dr. Ritu, are you having any issue presenting your slides?
Sorry, I was on mute, Dr. Ritu. I do have your slide open with me. Just let me know if you need me to project it.
Yeah, I think there is some issue.
Okay, should I go ahead then?
Yes, please do.
Is my screen visible?
Yes.
Perfect.
Okay, great. So in the presentation today, we will be learning how to communicate the risk. And we will also try and understand how risk perception influences the uptake of protective behaviors. And friends, as we understand that, risk communication and community engagement is a very important pillar that connects public health, affected communities, and helps to engage and convince people to act in a way that they can reduce their risk, they can follow the protective behavior which is being communicated by the government. And also it helps to understand what are some of the perceptions, what are some of the socio-cultural contexts and traditions which are rooted in the way people behave and the way societies behave. So it's a very important core capacity, which is also a pillar under the international health regulations. And therefore, all member states need to strengthen the risk communication capacities. And we know from our previous experiences with various public health emergencies that the whole government response hinges on how the communities perceive the risk and how they communicate, how the risk is further communicated, understood, and behaviors change exhibited. Next slide, please. So as we know, with the COVID-19 pandemic, this has taken overwhelming proportions, and very quickly, in a span of a few months, more than 200 countries have been affected. And we've seen that this is such an unpredictable public health event, and the way it has unfolded, this has led to a lot of societal disruption, economic disruption, and generated a lot of anxiety and behavior within the affected communities. And we also find that, when it started from Wuhan in China, how quickly it spread to other countries through international travel and involved multiple stakeholders, governments, partner agencies, donor agencies, everybody, the whole of society has to be engaged to ensure a comprehensive response to this particular pandemic, and how quickly it has shifted from being one country's issue to a whole world getting affected. So it's a really very unprecedented time. And within the context of the pandemic, we are also seeing that there is very rapidly evolving information and guidance, so much so that our DG, Dr. Tedros, in one of his speeches remarked that this is not just a pandemic, this is an infodemic with so much information overload. And therefore, this adds to the challenges of how the risk is communicated with a new disease, new interim guidances are being issued even by the World Health Organization and other agencies. And therefore, the entire spectrum of public health, milieu in which this pandemic has evolved is rather unprecedented and rather complex. Next slide, please. Next slide, please. So as we understand, even in our own country, this has taken so much more dimensions, and this is not just a health crisis. And even, when at the time when the lockdowns were announced and people were asked to follow physical distancing, stay away, look how differently it has played out within the communities. People have, perceived COVID-19 as a very, very, complex situation for them to understand. And this has evolved into much more than just a health crisis, with livelihoods, food security, many other issues also at large, which have been exhibited. Next slide, please. So we understand that when we really talk about risk communication, we are talking about certain behaviors which the population needs to do and follow. And then it is incumbent upon the government, together with partners, to inform and educate on what the population needs to do, and also to motivate and compel them to do so. So what, why, and how needs to be carefully explained to the affected communities to ensure that the entire population at risk is adequately protected from the infection of COVID-19. So what then it really calls for is creating a lot of awareness and knowledge about prevention behaviors, but also limiting the impact of the disease by providing, more information about how to improve hygiene, how to have better healthcare seeking behavior. But then it also calls for building capacity of a lot of professionals, those at the front line, those that are managing the healthcare facilities, those who are providing clinical management and care. So everything has to work seamlessly, and risk communication in itself cannot exist in silo, because so much more needs to happen. There has to be all the enabling factors in place, the machinery of the system, the health system capacities need to be able to deliver to reach the most marginalized and the most vulnerable groups, but also that we need such an important enabling environment. And within the context of our country, not only at national level, but also at state and district level, for risk communication and community engagement. And we'll be talking a little bit more about that in the subsequent slides. Next slide, please. So as we understand that the drivers then for risk perception and behavior change communication rest upon not just the capability of the person or the individual to follow that particular advice, but also in terms of how motivated they are to do so. What are the opportunities available to make sure that those protective behaviors can be followed? And all this then boils down to what kind of behaviors people are going to be exhibiting. Let me give a few examples. For instance, in an urban slum setting, we know that even if people are motivated to carry out physical distancing, sometimes this can be a rather challenging issue, because the density of the population is more, the housing conditions may not be enabling enough for people to follow those kind of physical distancing measures. There may be an issue of hand washing, maybe running water is a problem. So even though there is a certain set of risk reduction behaviors which are being talked about, how many opportunities actually exist in the field setting to follow that, how capable people are to do so, and what is their motivation to carry out these, protective behaviors, all that influences behavior and then behavior change. And on the left, you can see a wide array of, digital communication media, which are available in today's world. And we are such a digitally connected world. And we know that in our own country, many more people have a handset, a mobile phone, than there are really toilets in the country. So can we use those opportunities to ensure that the right messages reach the right audiences? And these are some of important considerations for risk communication. Next slide, please. So we also saw in the course of the evolution of the pandemic, a certain set of behaviors being exhibited because of fear and apprehension linked to the outbreak. And we do understand that when there is a new disease, there is like when we do not understand a particular disease, when it's new, when it's foreign, there is not enough information that is available, accessible. People don't know how much is the risk. And with 24/7 journalism, also with narration of a lot of negative stories about the morbidity, mortality linked to the disease, multiple pictures being shown of healthcare providers falling sick, etc. There is a certain sense of anxiety and restlessness that sets within the communities, and therefore it becomes very important that the government quickly brings in a trusted source of information. And we have been working very closely with Ministry of Health, Government of India, and a lot of information has been shared regularly, updated. And we would highly recommend all the agencies that have joined today to visit Ministry of Health websites, PIB websites, WHO websites. Please make yourself aware of the facts around COVID, because this is a new disease. And facts really help to detail out what we need to understand. Sometimes the way the communication, messages are directed, there is a very different meaning and connotation which the public hears. Today, in the world of social media and digital media, when we get certain informations from 10 WhatsApp groups, we tend to believe it. We tend to think it's true. We sometimes may not even do a fact check. So that's the kind of misinformation also spreads very quickly. And we are seeing that a lot of fake news has also been circulating. So therefore, it then becomes very important to understand that while one is dealing with a new disease, how risk communication needs to take into account the socio-cultural context, the drivers of the disease in general, how people are perceiving the disease, and then also the kind of listening that needs to happen to ensure that all those mechanisms are used to further guide the policy response that needs to happen. Next slide, please. So we know that this being a droplet infection, we are really talking about frequent and proper hand washing, maintaining physical distancing, practicing respiratory hygiene, avoiding touching eyes, nose, and mouth, and disinfecting surfaces and objects. So while we know that these, this is not foreign, I think everybody who has joined in today is well aware of these, prevention messages, but still, what we find from some of the early surveys which have been done is that sometimes people do not do this consistently. Sometimes they may forget, there may be a let up. So one then needs to reinforce the COVID-19 prevention as much as one can, especially as lockdowns get eased up and people tend to come back to workplaces and life begins again in terms of businesses. So what we are also trying to understand is that for those that are having symptoms, early healthcare seeking behavior is very critical. And therefore, we, as part of WHO and UNICEF partner agencies, we have trained a large number of people who have been also part of the 1075, 104 helplines, trying to take questions from citizens, because we know and we understand that when people call up, they are looking for that kind of information and messaging, and what then needs to be conveyed needs to be done in a very, very risk appropriate manner, as also guiding people on where they can seek, healthcare as a next step. So really, this is about staying home, staying safe, and if you do have symptoms, following the guidance to ensure that you contact a healthcare provider. But before you do that, ensure that you wear your face mask before you even go to a healthcare facility, because we are really talking about ensuring that the disease is further limited in terms of its spread. Next slide, please. So just click all the buttons which are linked to this particular slide. So when we do talk about interventions and we talk about different personal protective behaviors, we are talking about, washing hands. And when we do talk about washing hands, this also calls for behavior change because we understand that people forget. So, the workplaces, the buildings, all of them need to be then, enabled to ensure that there are these resources available. People need to break their habits of touching their face, and we do not know how many times we touch our face. It's such a such a habit, and we don't even recognize that we are doing that. So these are about breaking certain habits and behaviors and ensuring that these enablers are made available, and the routines that people follow ensures that, for instance, sneezing and coughing into tissues or into a handkerchief. So one does then need to have all this, and then making sure that you're carrying your sanitizer, you're carrying your soap wherever you are going. So even in terms of physical distancing, we know and understand that even when people go and buy essentials, we find that sometimes this is becoming difficult to implement. So how we can have reinforcement of some of these messages and personal protective behaviors is also critical to understand. Next slide, please. So this was tweeted by the ministry, and again, this is talking about how everyone is at risk, and in case it's best to avoid crowded places, and that helps to prevent you and your family members at being at risk from this particular disease. But also in terms of understanding that those that are at serious healthcare outcomes, such as the elderly, those with comorbid conditions, how one then needs to make additional interventions to keep these vulnerable groups safe, and how the behavior of the youth in the families also influences the risk to which the vulnerable groups are exposed. Next slide, please. Next slide, please. Yeah, just click all the buttons. We're also finding that the COVID-19 pandemic is triggering is triggering very strong emotions among the population. And we are finding that a lot of instances of behaviors which are discriminatory are also coming forward. For instance, you can see man held for beating up vegetable vendor, people from Northeast facing discrimination, again, resident doctors being targeted for spreading COVID, doctors and nurses facing stigma over coronavirus. So again, it's entirely the fear that drives this kind of behavior. But we do understand that it's important to recognize that there is stigma in the society currently, which is happening, and then think about how we can, as civil society, we can help address it. So can we have the question on the stigma, Valerie, now, if possible?
Sure. So this is for the information of the participants. I'm launching a poll right now. You will see a question on your screen and certain options. You are allowed to choose multiple options based on your understanding of the question. I'm going to launch the poll now, and in about a few seconds, it should be on your screen. Is the poll visible? Can somebody respond?
Yes, yes.
Great, thank you.
So this is a multiple option question. You don't necessarily have to click one option. You can click multiple options based on your understanding.
We shall give about 15 more seconds for the completion of your answers, please.
We want more people answering. We just had about 40%.
Yeah, we have 85 out of the 211 people who.
Yeah, so just let's give them another 30 seconds.
Sure, sure.
This is just for our own understanding. It is not meant to, judge your perception. This is just about for us to understand what is the current level of understanding of the group in terms of recognizing stigma. Wonderful. Now we have at least 50%.
Right. Do let me know when you'd like me to close the poll.
Okay. I think we can close now.
Sure.
All right. So then, yes. So we are seeing that, stigma is being exhibited not only against people who are being affected with COVID. Yes, those are being affected with COVID. Definitely, there is because of the fear that people have about this new disease, but also people who are having to undergo quarantine, their family members, their friends, returning migrants, even those who are recovering from COVID-19 and coming back to their families, their neighborhoods. People think that no, they are still infectious, they can still pass on the disease, when that is so not the case. And we need to understand that this is all stemming from the fear which is associated with this disease, and how there is a very proper Government of India protocol. People have to be certified, lab tested twice, and only then the discharge of the person happens from the hospital. So, and also we are finding that a lot of essential healthcare functionaries, doctors, nurses, ambulance drivers, those providing essential care, even police personnel, people who are really doing very good selfless work, and they are the major, they are the fighters. We need to really celebrate their role. And still we are seeing that a lot of stigma is, we can remove the poll question now, Valerie. That's all right now. We can go on to our slides.
Okay, I'll move to the next slide then.
Yeah. So we are then, as I mentioned, seeing that various categories of people are being labeled, stereotyped, discriminated against just because of a perceived link with the disease. So what is our main key takeaway message for you today is that you have to understand and spread the message that anybody can be affected with COVID. Anybody who is not following due precautions can be affected with COVID. It really does not matter what area they belong to, what religion they belong to, what profession they are in. Anybody can get affected. The most important thing that we have to do is focus on the facts. And when we do focus on the facts, we talk about COVID-19 prevention and we spread those kind of messages. So everybody should be responsible for their own behavior. It is very important to empathize with anybody who may be getting affected with COVID. So let's spread kindness, compassion. This is really the time for social cohesion. Rather than pointing fingers or blame that. And also let's be responsible citizens. Let's not share personal details of which house is having what number of cases, which colony, house number. All these kind of personalized information should not be shared, especially on WhatsApp and some other groups. And the most important key takeaway message today is that let's take care of ourselves, take care of those around us, and take care of those who are working for all of us, our corona warriors. So we are seeing that not only people who are getting affected with COVID, people under quarantine, doctors, nurses, those who are recovering, people belonging to certain ethnic minorities, even migrant workers. So I'm very happy with the responses. We do understand that people, civil society has a major role to play when we talk about stigma reduction. Next slide, please. And we also understand that why there is a need to reduce stigma is because when there is stigma, people start hiding their symptoms. They think, What will the neighbors say? What will our family, rest of the family members say? What will, I don't want to go under quarantine. I don't want to go to a COVID care center or a hospital. No, I can be fine. I'm home. No. So all this behavior leads to undesirable outcomes and therefore hesitancy in seeking medical care and people not adhering to interventions. Again, there is a feeling of guilt and anxiety. We are also seeing feeling of helplessness, loss of self-esteem and confidence. And therefore, the risk communication and stigma reduction is very, very closely linked to the psychosocial aspects of this particular disease. And there is so much need to ensure that those who are getting affected get all the support from their family members, from their, others, those who are around them. Let's come together as and build a collective consciousness about this particular disease. Next slide, please. So really, this is a very important issue, and globally, the health, safety, and morale of healthcare workers has been talked about. We do understand that these people really at the front line, they're fighting the disease. They are the warriors, and how important it is that their morale needs to be high. And stigmatizing behavior against healthcare providers tends to lower their self-esteem and comes in the way of them performing their duty as per what they need to. And friends, let's also recognize that it is not easy to wear personal protective equipment, and work in those kind of settings. It takes a lot, it takes a toll on people. So really, the least we can do is celebrate their role, give them the sort of encouragement that they need. And we need our civil society members, agencies to really come forward, share with us good audio visuals of how these warriors are performing their duties in the field. And we welcome, as World Health Organization, we would really welcome if civil society partners were to share with us short films, AVs. Please share with us positive stories of recovery of those who are providing good role. And in the last couple of weeks, we have had very good interactions with faith-based leaders, RJs, civil society partners, and a lot of people are coming together to support COVID-19 response. Next slide, please. So there is a whole Government of India campaign to combat stigma, and this whole national campaign has brought together all the partners, and on a weekly basis, we have calls, and we are trying to ensure that we support the Government of India at this point to address stigma and discrimination. And the government has also come out with the ordinance on the legal front, which ensures that if anybody, any violence or any harassment of healthcare workers is happening, then there are legal measures available to ensure that that does not happen. So there is a very high level of commitment and ownership with regards to risk communication and stigma reduction from the Government of India at this point. Next slide, please. And as I said, the safety of healthcare workers, doctors, nurses, and allied staff is of great importance. And a lot of training programs have been conducted to ensure that these people are kept safe, because they are our army right now. And a lot hinges upon, the role which is being played by healthcare providers. Let's not forget that if anybody in our families gets affected, finally, it's these people who we are counting on to make sure our family members come back safe. Next slide, please. So when we really talk about risk communication, we really need to understand what are some of the concerns. As I said, the anxiety level, what people think, what is their perception, how they are behaving, how even the media is consumed. When we talk about the role of media is immense. We have been also interacting with a lot of media houses and radio jockeys, and we really understand that these are the people, these are our partners, these are our voices in the field. And a lot depends on, because the population really adheres to a lot of guidance which comes from these sources, in addition to the authentic websites of the Ministry of Health. Next slide, please. Yes, so when there is a evolution of a risk communication and a community engagement plan, then it's really important to ensure that we include all the marginalized and vulnerable people. As we understand that for this particular disease, the people who are most vulnerable for serious outcomes are those who are elderly or those with comorbid conditions. But we are also seeing that within the period of these lockdowns, etc., there have been increased cases of gender-based violence. We understand people are home. There are many more risks and drivers. We are also seeing that because of closures of schools, workplaces, this has had an impact on families, on children, and especially based on our knowledge from other public health events and emergencies, we know that those that are, those we need much more targeted interventions for those that are marginalized, those who are having chronic conditions, including HIV, cancer, some of the other comorbid conditions, but also those who have disabilities. So the plan then really needs to have targeted approaches to ensure that we reach the most marginalized and the most vulnerable also as we move forward in terms of ensuring that our behaviors change, mechanisms and policies are implemented. Next slide, please. So this then really calls for a lot of community engagement for the success of the overall outbreak containment and reducing further transmission and combating stigma. And for us, the major question is, how do we reach the last mile? And so in the last few weeks, we have trained a large number of frontline healthcare providers. We've had various interactions with ASHA workers, Anganwadi workers, those who are at the frontline, volunteers, volunteers of Red Cross, Nehru Yuva Kendra, NSS, many other groups, Ayush doctors, all those people who are, who are delivering the sort of messages to the communities need to be made aware of the risks themselves, how to keep themselves protected, but their own role in terms of contribution to the overall COVID response, and how to make sure that the kind of behavior change that we need within the community is shared down to the last mile. Next slide, please.
Dr. Ritu, I'd also like to ask you to wrap up in another 4 or 5 minutes, please.
Okay, yes. So what we are seeing is that behavior change is really possible when we talk very clearly and specifically, and we focus on a small number of key behaviors rather than having a very long laundry list. Next slide, please. So what we are recommending everybody, and we will also recommend it to the CSOs who have joined us today, is that let's start using more positive vocabulary around COVID. Let's offer words of encouragement, extend compassion, because the way we say every word matters. Let's choose to narrate positive stories. We also understand that for most people, this is a disease from which they will recover. 80% and above only have mild symptoms. So the paranoia which is created when there is a new disease needs to be lessened. Let's help to allay anxiety within the population. And when we use words such as people affected with COVID, instead of saying people who are cases, or when we say people who may have COVID, instead of saying a suspect case, then those are positive vocabularies. And this is what is being recommended by the World Health Organization. Next slide. So while we are talking about physical distancing, we are also talking about being emotionally connected. And there are many ways of doing that. So let's ensure that while we are following all the government guidelines, there is also this sense that we are connected in this together. No one is alone. And how we can provide more care and support to those who are most vulnerable. Let's focus on that. Next slide, please. So as I mentioned, then community engagement is not just sharing of, no, just go back to that slide. It's not just sharing of, pamphlets and leaflets. This is so much more. And we really need to come down to understand what does it really mean for the communities, how we can help them, enable them. This is not just about having TV spots, radio spots, campaigns, posters, leaflets, messaging. This is about the uptake. So it's really a two-way process. It has to be a dialogue. Next slide. We can skip this one. Next. So when we talk about three key areas of risk communication in which we are focusing, it's about the health emergency communication, where we talk about accurate dissemination of information during the crisis. We're also talking about operational communication, because there are many agencies, actors, authorities, consistency of messaging and a smooth chain of command and coordination between the various actors as well. And then finally, we also talk about behavior change and ensuring that there is social mobilization and people adopt the protective behaviors. Next slide. And when we do that, we are also leveraging on the strengths of the local influencers, the faith-based leaders, people who have a stronger voice within the communities, the trusted voices of the community. And in the past few weeks, we have jointly with UNICEF, Ministry of Health, other agencies, we have connected with a lot of faith-based leaders, and we are advocating for COVID-19 prevention. As we understand that the reach and the, because this is the time of a lot of uncertainty, people turn to faith leaders for solace. And so we have seen that these people play a major role in reducing the illnesses linked to COVID-19, and we have been working actively with these groups. Next. So this is perhaps the most important slide as a takeaway from us today, that when we really talk about risk communication, we talk about a mix of strategies and tactics. And you can see a whole list here. It doesn't stop at media or social media or mass awareness or IEC, but it covers a wide variety and a wide array of activities that ensure that we are able to connect as part of the RCCE with the affected communities, the public. We are able to convince them to act to reduce the risks, as also understand their needs and perceptions. Next slide, please. So many channels and tools are available in today's digital world also, which have been used extensively. And we would highly encourage all the CSOs who have joined us today to use their own channels to amplify positive stories, share stories which are being reflected on PIB and other Ministry of Health websites, on WHO websites, because then we know that the outreach and uptake of these materials is much more. Next slide, please. And while we do the risk communication and community engagement, it's also important to monitor and track and take into account how well the RCCE plan is functioning. So we look at the healthcare seeking behaviors, we look at trends, we look at monitoring media, social media, trying to understand from key informant interviews, focus group discussions, surveys. And all this helps to better understand the needs of the community and helps in evolving the risk communication plan and strategy further. Next slide, please. So there are a lot of materials and resources which are available from WHO, UNICEF, and other websites that you can refer to when you're really dealing with the communities, and which can come in handy. And some of these have been adapted also for use at national level by the Ministry of Health in consult with other partner agencies. And we are working together with UNICEF on this one. Next slide, please. I also wanted to share this Lancet publication, which you can go through later, which really talks about how community participation is crucial in a pandemic, and how countries across the world are trying to understand how to have the communities engaged so that the right kind of behaviors can be adopted. Next slide, please. Yes, so these are my last slides. What can CSOs do? We are really talking about you working with the local leaders, frontline workers, teachers, Gram Sabhas, Pradhans, religious leaders. Help us to get the right kind of messages to the community, help families to understand the disease and risk, support the government in preventing and fighting against stigma, share Ministry of Health state helpline numbers, and you can also coordinate with existing groups such as self-help groups, youth networks, village health, sanitation, nutrition committees in ensuring not just healthcare delivery, but also emergency services, food, groceries. Many of these areas are already being covered by a lot of CSOs and NGOs. And we also understand that these are also avenues for amplifying the messages for risk communication. Next slide. Yes, so when the virus does not discriminate, why should we? So let's talk about compassion, assurance, respect, and encouragement. And let's take these positive messages further. Let's talk about protective behavior and not blame. Let's talk about social cohesion and not stigma. Next. So thank you so much for the opportunity for sharing our thoughts with you. And we know that it's new disease. We are all learning, but we are happy to take feedback, any questions. So thank you so much. Thank you, Valerie.
Thank you, Dr. Ritu, for putting those points together for us and for your wonderful presentation. I will now invite Elnoor to please step in and to your presentation. Elnoor, can you hear me?
Yes, in a few seconds, I'm coming.
Great, thanks, Elnoor. In the meanwhile, I would request the participants to post their questions in the chat box. If you want to address the question to one particular resource person, then please feel free to do that as well. And we'll also be taking live questions with all of you in an interactive manner at the end of this session. So you can use the raise hand button next to your name, or below the chat box, and you will find a raise hand button. Just use that and we will take up your questions after the session.
Okay, I'm just sharing my slides. So I'm trying to share, but share button. Okay. Is my screen? Can you see my screen?
Right, it's visible.
Yes.
I think 2 participants raised their hand.
We will take the questions at the end of the session after your presentation, Elnoor.
Okay, very nice. So, good afternoon, ladies and gentlemen, dear esteemed colleagues, partners, and I see we have university teachers, professors among the participants. So I would like to welcome all of you in this today's session, and thanks to our WHO partner colleague Dr. Ritu for the great presentation and insights from WHO on risk communication and community engagement. And I'd like to open my session with a powerful quote from Mahatma Gandhi, and whom I inspired since my childhood. Although I am not Indian nationality, but he was a very famous person across the world. So, and I thought that his quote would be more suitable and relevant, and relevant to all of us. Once he said that the best way to find yourself is to lose yourself in the service of others. And this quote comes on time, and all of us should lose ourselves in the service of others in order to fight against COVID-19. And all of us, all of us, we are this together, and we have to fight against COVID-19. It's because of not only it's because of our nation's future. So currently, my country, neighboring countries, and all community, they're fighting. And the purpose of this today's session is to dive and to brainstorm on the risk communication and community engagement is one of the strategies that we may employ, we may learn, and we may adapt and use this knowledge to fight against COVID-19. And so objective of the session is mainly to strengthen our knowledge and understanding and enhance our capacity and capability on risk communication and community engagement. You've heard already from Dr. Ritu regarding what is the risk communication and community engagement. But at the same time, we need to better understand what is risk, what is communication, and what is the communities, and what is a community engagement. So that kind of, the links we need to understand in order to strengthen the network of our knowledge. So that's how we are going to achieve this. So the greater understanding, what are the concepts and approach, and defining the RCC strategies to achieve that in practice in the field. And also knowledge and experience on how to apply the concepts and approach in the context of India, in the context of states, in the context of districts, in the context of the blocks. Because we cannot say that the one size does fit all, but the overall principles and overall approach might be applicable, relevant in order to bring the effectiveness and efficiency to the work that we do together. So I would request Valerie, we will start from the question and answer in order to define what is the risk communication, what is the community engagement, how we are communicating the risk. So may I ask questions for Paul to come in and to ensure that our conversation, our communication is mainly interactive. Can I have a poll questions?
Right. So for the participants' information, I am launching another poll which will be visible on your screen in a few seconds. Please mark your answers. The poll should be now visible on your screens. It's a multiple choice question. You can choose more than one option. We shall end the poll in another 10 or 15 seconds, please.
Yeah, 15 seconds. I believe we can end.
Absolutely.
60%.
Ending the poll now, and the results of this poll will now be available on your screen.
It's really great to hear the multiple choices about what is a risk communication. And I would like to bring one interesting point. When I was studying in the university, and one of my professors, I was listening in the auditorium, and they told to me that he asked me that, do you know that's why God created 2 ears and 1 mouth? I don't. Why? It's because in order to listen more and to talk less. So I see that here we have really, it's about listening people. Yes, it is right. And also it's about the exchange of information. It is exactly. And wearing a mask, it's about the risk. And how should we communicate regarding the wearing a mask on the communication? So I would like to put. Okay. So this communication is an exchange of information, and I see that 75% already responded to that. That I'm really glad. Among our participants, we have many people that they know what is a risk communication. Advice and opinions in real time between experts or leaders and the community facing a threat and danger to their survival, health, economic, and social well-being. So that actually the risk in itself is a possibility or a chance of loss, danger, or injury. And an example in this current time, later on I will go for one of the evidence generation, that wearing a mask, it's those people who do not wear the mask, they're putting themselves under the risk, and plus they're putting others under the risk. So that's wearing a mask, it is the non-wearing the mask, it is a risk. So we are moving to the next question. What is community engagement during the outbreaks?
I'm launching another question on your screens. It is a multiple choice question again. and it should be, I think it's not multiple choice, this one. I'm sorry, but you can still please go ahead and mark your answers, even if it's a single option. Let me rectify that for the next poll. We will end the poll in the next 10 or 15 seconds.
Yes. As soon as it will reach the 60%.
It's actually 80% people have already voted. Okay, I am going to end the poll now, and the results of this poll should be visible on your screen now.
Excellent. Thank you very much who responded, and all 80%. That is really great, and I'm really glad that one of the responses of what is community engagement, it's about the partnering with communities. Communities, they're not the target. Community members, they are the participants of the processes from the beginning to the end. So,
Noor, would you like me to keep displaying the
yes. Sorry?
Should I keep the results on the screen or should I take them off?
Could you please take them off?
No.
So that community engagement during the outbreaks, it is exactly what you've responded about. It is about the mutual partnership between COVID response teams and individuals, communities in affected areas. It's about the ownership and controlling the spread of the outbreaks. Communities should own the processes and control the spread of the outbreak. Community, it's about the trust, confidence, self-esteem, and the self-discipline of the communities to respond. As much as communities will be the partner, and they are the partner in the processes to fight against the COVID, it means there is a processes that in these communities, stigma and discrimination will be eliminated. In these communities, COVID response will be effective and efficient. So now we are moving. What do you think about the objectives of the risk communication? It's about the come to an assistance. It's about provide accurate information in real time and adapt it to the needs. What does it mean adapted to the needs? It's adapted to the needs and needs of the local communities. It's about persuading the communities and creating and restoring the trust. If the people, they don't, in the books, I have read one response. The question, it was about the if someone approaches and wants to sit next to the neighbors, and the people, they say that don't sit here, you should go home. Is this a stigma or discrimination? But I believe that it's about the trust and confidence between those people, means they're assuming the responsibilities of keeping the distance 1 meter and wearing the mask. So in this case, it's about the self-confidence and the trust as well. So the objective of this communication, it is also about the trust. It's about the providing accurate information. It's about the working with the communities, and it's about coming to an assistance and help each other and support each other. So we have the last poll. How do you think risk should be communicated? Valerie?
I'm launching the poll now. The poll would be visible on your screen. It's a multiple choice question. I fixed the error and you can mark multiple options. So please go ahead. We shall keep the poll active for another 15 seconds.
Yes, please.
I am ending the poll now. I see that 67% people have already, 68% people have voted. The results should be now displayed on your screen.
Thank you very much for the responses. How do you think the risk should be communicated? I believe, and I see you have experiences. Most of you, you are relying on the social media in the context of COVID due to the social distances. At the same time, we have here the Panchayat Raj institutions as a community delivery platforms and plus the self-help groups and community radios as well. So that this is just a limited number of the communication channels that can be used for the risks to be communicated with the communities. And also the we would like, so that can we stop sharing and I would go to the presentation.
Right, I've stopped sharing now. Please continue.
So exactly, you see that power of the social media nowadays is enormous. At the same time, it's a channel, various channels of communication, mass media as well. But what might be effective and efficient in terms of the one person has a hesitant to do the or has a challenges of keeping the 1 meter distance or as a challenge to have the mask to be wear. How can we convince this person? How can we convince the communities? So the effectiveness and efficiency of the use of the communication channels, it should be more strategic. So that through various channels of communication, the person should hear the one message and one action. And these channels of communication should be complementary to each other. So that if the person hears the information from the community radio, at the same time, self-help groups or village panchayat, they come and they talk about this and they will able and providing them the solutions. In that case, we are in a better position and to fight COVID-19. It means that we are effective in communicating the risks with the communities. So now I am moving to the few PowerPoints. It's about the principal concepts and approach to COVID-19. And it is applicable across the world, but especially in India. So for key principles, there are 3 key principles for an approach for the COVID-19 to respond. The first one, be first. Second, be fast. Third one, be frequent in order to communicate the risk with the communities. For instance, early first announcement established the build and maintain the public trust. But what to announce? It should be the right information and the trust for the information about the safe practices. Second, it's about awareness of the disease and the situation is a key, especially among the healthcare providers and the population at risk. So that to maintain the public trust, to move to the awareness about the disease, the virus, as much as the people, they perceive the risks associated with the disease and along with the public trust brought by the healthcare providers, this will be first and fast, and be proactive in information dissemination and with frequent updates, so that the people, as soon as they hear the information from the healthcare providers, from their neighbors, from others, they seek the information on a daily basis, on hourly basis, about what is this is about, how should I protect myself, and it applies across all the communities. And information dissemination through the various channels of communication should be complementary. so that misinformation should be avoided. And what is, if we are first, if we are fast, if we are frequent, it means that we are enabling our communities and the people to take informed decisions to protect themselves. And how to also to inform how to help them to make the informed decisions. It's about develop easy to understand materials in different languages and preferred channels of affected population. I would add here preferred channels and plus trusted channels of communication for the affected population. Identifying and managing the rumors and misinformation quickly and to respond to that. And using a mix of tactics and approach on the risk communication, including one way of communication through the mass communications, two-way systems to promote participation and inclusions, and promote the local leadership, local capacity, local empowerment, and local ownership over the information, over the actions. In this case, we would be in a better position to communicate the risks with the communities, and the families. One of the challenges of COVID-19, it is about the new practices and the norms. And especially for a country like India, it is not easy. It is not easy in terms of social distancing and physical distance. It is not easy in terms of staying at home for 40 days, 30 days, 1 month, 2 months. So what might be the solution? In a crisis, people are more likely to make decisions based on the trust, self-confidence, and self-discipline. And the trust in individuals and organizations is the biggest factor, reducing the risks by adoption and maintenance of the new norms and practices in disease outbreaks. And I believe in the power of the communities, and I believe in the power of the indigenous knowledge of the communities. And through the photos, you can see that how it was easily adapted, the social distancing, means a physical distancing in certain, the context, except urban slums. And how it was easily in terms of strengthening the, for instance, the greeting each other and like namaste. And however, there was a challenge. So that once we are communicating the risks, once we are talking about the diseases, but at the same time, we need to provide the right information and the easy solutions for the communities to adapt and maintain the new practices. So next few slides, we will be talking about the evidence-driven risk communication and community engagement. Evidence is one of the key components for any communication to act, and especially for risk communication and community engagement. With the evidence, risk communication becomes more powerful to reach the minds and hearts of the people with the right information to be delivered on the right time to take the right actions. So with UNICEF is coordinating on behalf of the development partners under the leadership with the Ministry of Health, the National Stigma Discrimination campaign. And I believe that you are also part of the stigma discrimination overall interventions in your respective areas, working with the CSOs or in the communities. These are the brief snapshot that talks about the stigma and discrimination in urban slums. So that I will not go for the details, but the 93% worry how they will be treated as a designated isolation facilities. Or 33% of respondents say that the health workers are seen as the one who spread the infection. And I see here the only one response. we are dealing with the trust, we are dealing with the confidence, and we are dealing with the misinformation, and we are dealing here with the fear of the COVID-19, which brings stigma and discrimination to the thing to fight. And that challenges us as the COVID warriors while we are fighting the COVID-19. However, evidence-driven risk communication leads us to define the 4 strategies. And that was the strategies. It was about the advocacy, amplifying the voices of the highest leadership at national and the state level, capacity building, and I would add here the capability building as well. So that's training, capacity building of all stakeholders who can and who are fighting COVID-19. Capacity building of PRIs, CSOs, SAGs to respond to the COVID-19 challenges. Community engagement through the power of the faith-based organizations and also non-health platforms, plus 200 community radio stations engaging with close to 1 million people. And another one is a media engagement, which is a critical one to consider, that how media engage with the communities, how media engage with the public, with the information to reach with the actions and safe practices. So that social media, as rightly mentioned in the beginning, and thanks to the respondents, that social media reaches billions of the people in the country. And another area for the evidence generation for the risk communication and community engagement, UNICEF, we did the U-Report rapid assessment. And U-Report is a mobile-based application that engages the respondents to answer the few questions. And I have extracted few of them. One is related with the risk communication and community engagement. For instance, 92% have heard about the COVID-19. But being aware, it doesn't mean we understand the risks about what is a COVID. Everyone heard about the COVID. They name it as a disease. Some of them, they name it as a virus, but it doesn't mean that they are aware, but it doesn't mean that they have a knowledge and understanding on how to protect themselves from the COVID-19. So they've heard this information and they consider they get this most information from the different channels of communication. And you can see here the television, it comes first, and it's a primary source of information across. But also television is followed by the Facebook and WhatsApp. This is in line what you responded. So in a summary, social media is one of the powerful platforms for the community, for the people to discuss, to engage, to express their view, opinion. But how to translate the social media discussions, how to translate those engagement in virtual world to the real world in order for them to take action. So here my one of the last slides, that's in a red you see the soak in sun, avoid non-veg food, use herbal, homeopathic remedy, do nothing, it is all political. This is about the risks. This is how the people perceive their protection. So that risk perception is a key in the risk communication. So but at the same time, wearing a mask 15%, it's also considered as a risk as well. So that when we are communicating with the risk communication and community engagement, the evidence generation, knowledge, attitudes, practices, behaviors, insights, these are the key for us to understand the trend. How should we communicate the risk with the communities and with the families? And then defining the different, the strategies to address those risks. For instance, if we have a risk associated with the community members, of course, the community engagement strategy should come first, along with other strategies like media engagement strategy, like social media engagement strategy, or capacity building strategies. So, in summary, I would like to call our participants to be active after this session, after this risk communication and community engagement, more active. Why? Education is about to increase the knowledge, awareness, and understanding. Engagement is about the reflection and contribution to the whole processes. But the key one is the empowerment. And we believe that with this empowerment, we enabled you to become the change makers. You're already doing the best, but we need to be the best of the best in order to fight against the COVID-19 and its causes, stigma and discrimination as well. UNICEF, WHO, USAID, and many other development partners, we came together to support the government of India, Ministry of Health and Family Welfare to fight COVID-19. But we do realize the role of the civil society organizations, including universities and academia, including the media and the non-governmental organizations. It is powerful to have now solidarity to come as a social movement to fight against COVID-19, at least to reduce its exposure and at least to stop the spread of the COVID-19 in our countries. And with this one, my way forward would be to be the first, to be the fast, and to be frequent with risk communication, community engagement interventions to reach healthcare providers and caretakers to narrow the gap in, for instance, in essential services. To be the first, fast, and frequent with the risk communication, community engagement interventions to reduce the exposure of the impact of COVID-19. And to maintain COVID-19 specific practices, especially physical practices, use the masks and hand washing with soap at all levels, including the facility level. And last one is UNICEF. We have the IEC warehouse, and in order to be the fast, first, and the frequent, we developed and the functioning UNICEF IEC warehouse, where you will able to find more than 20 regional languages, the different, the materials to be used, disseminated to support your work to amplify the voices of the communities. Thank you very much, and we are ready to get the response, to get the questions. Thank you.
Thank you, Al-Noor. There was a very engaging discussion going on in the chat box as well. We have with us actually Mr. Siddharth Shrestha, who's also a part of this session. He's presently the Chief of Communication for Development for UNICEF India, managing the social and behavior change communication portfolio. And he would like to come in with a few comments of his own. So Mr. Sid, I've made you the co-host. You could unmute your mic and speak now.
Sure. Thanks so much, Valerie. Thanks, Ritu and Elnur, for a very engaging presentation. And I'm also sort of every time we do these presentations, I think we also learn more. For example, the polls, which is coming out to be quite interesting, given the fact we're doing a lot of digital webinars. Just a few pointers in addition to what my colleagues Ritu and Elnur mentioned. You saw from evidence that from Elnur's slide, 92% of the people are aware of these key prevention behaviors on respiratory etiquette, hand washing with soap, seeking health, seeking medical facilities, or going to a doctor if you have symptoms, all of these. But the point right now in this current context, what is very important is to focus also on other behaviors such as psychosocial support. That's very important. I saw quite a lot on the chat box. That's why I wanted to come in and give my thoughts around that. It's not just enough to look at the prevention behaviors, what we are doing, like I said right now, but absolutely important at this point of time to look at, for instance, mental health, to look at psychosocial support behaviors. There is a lot of violence going on, right? We see from reports domestic violence and also violence against children. So that's something which is absolutely important. The second one I wanted to mention, again from the chat box, I saw 2 or 3 comments on social entitlement. Absolutely bang on. What is also what we are trying to do, even in the urban slums, or as a matter of fact, in all RCCE, which is quite dynamic in the process, is to link the risk communication behaviors to social entitlements. So people are more worried, rightly so, about livelihoods, or where do they get their next ration from? Is there a scheme in their community where they will have access to the rations, or access to some cash grant schemes, access to some service grant schemes? That's also part of risk communication. So what in a nutshell, what I'm trying to say is, when we talk about risk communication and community engagement, we need to package this in such a way, because we need to look at what is in it for the communities, not just by saying wash your hands with soap, but looking at a more holistic manner, giving them access or information on access to services, because a lot of people might not know information on access to services, making them comfortable. We talked a lot about stigma, making them comfortable about going to a doctor if they have symptoms, because a lot of them also from assessments are seeing, particularly in the urban slum setting, that they don't know what's going to happen. It's a big dark hole for them if they have to go to a quarantine center, because they don't know what is there, and they've been told a lot of other things. So that's super important. So in addition to all of these, so one example, what one of the states are doing is the migrant, or I would rather say the homeward bound population who's going home. They are looking at linking them to self-help groups. So when you link them to self-help groups, there is already an opportunity of some income generation. So that's a way, that's an example of looking at, giving them or trying out access to social schemes for vulnerable population. And finally, I think what is very important is, this is an ask from both UNICEF and WHO, that you also have a very strong role to play. I saw some comments there in risk communication. So it can be as simple as looking at some of those, there's a lot of materials there, right? Pushing those materials through WhatsApp or through your own channels. If you already have volunteers on the ground, going and trying to talk to the communities, not just on the preventive behaviors, but also reducing stigma, talking about psychosocial support behaviors and convincing the communities that why is social distancing important at this point of time to maintain it as much as physically and mentally possible. So you all also have a very strong role to play in risk communication, and we would really, really like you to play that role even more stronger across wherever you are in your geolocations, in your states, in your districts, in your blocks, and in your villages. Thank you so much, Valerie, for giving me this opportunity. Over to you.
Thank you, Sid. That was very important. I mean, I think you could help us address a lot of questions actually that were coming in the chat box. So, Dr. Ritu and Elnu, should I go ahead and take the questions? A few more
Yes, please, Valerie. I think I cannot help agree more with what points Siddharth just made. And what we can do is we can provide a list of the helplines, whether it's the child support helpline or the mental health or psychosocial support helpline. And in one slide, we could also share all the helpline numbers with those who have joined us today. I think it would be critical because there are these resources which are available now from Government of India, which people can use to guide people who may be needing additional interventions. And I think it's important that we share all the relevant critical helpline numbers with everyone.
Yes, I think that would be super helpful. So at the end of the presentation that you made, I will insert the slide with all these details and our participants can then download it from the resources section. In the meanwhile, I'm now going to go to the raised hands. We have Mr. Avinash. Mr. Avinash, I'm sending you an unmute request. Are you there?
Yes, hello.
Yes.
Yeah, thank you very much, Valerie, and thank you, Dr. Ritu and Mr. Elno for this talk. I've done my PhD in biotechnology, and I'm a recent enthusiast about the risk communication strategies and methods that are used, especially the Ebola case, what happened, and the WHO risk management on that. I was only curious to know whether risk communication, whatever was shown by Dr. Ritu, there are so many components to it. I believe there's a central managing component that manages all the different strategies or the roles of risk communication. I was curious to know if risk communication is generally expected to be more effective in a decentralized system or a centralized system. Like suppose Indian context, we have a decentralized kind of combat against COVID. And so risk communication can effectively act in a decentralized manner or in a centralized manner. This is something which I had a curiosity doubt. So I'm very naive to risk communication.
I think that's a very good question. I'm happy to take that question. See how it happens in a country as diverse and as, with a billion population. We also understand that with health being a state subject, there is so much that states are really asked to do, but there is a lot of oversight and guidance which is provided by the center. Mm-hmm. And there is a whole communication task group which is working on some of these materials, ensuring that there is good partner coordination, ensuring that the right kind of messages are being delivered, the appropriateness and the vocabulary of the messaging is then shared with the states. There is a lot of guidance which states are being given also on what kind of communication messaging would be important as circumstances evolve. And we do understand with this being a evolving pandemic, there are, when during the lockdown, there are a certain set of requirements for risk communication. Post the lockdown, many of these requirements will also change. So as we understand, there is a differential strategy that needs to be followed for urban settings, places which have high density of populations, also trying to understand, as we alluded to in our presentation, for migrant workers, some of the other high-risk groups. So a lot of guidance is provided by the union level. And of course, states have their own creative independence to take many things forward as they would like to. And some of our states are doing wonderfully well. And there are these examples that need to be documented and shared with other states. Over.
Thank you very much. Thank you very much.
Thank you for that, Avinash. For that
may I come in just few notes as well?
Yeah, Elnur, go ahead.
Yeah, decentralized and centralized systems. The overall, the health system, it is RCC should be part of the health system strengthening. This is the first. And for health system strengthening, we are talking about the health communication system as well. I would say that it is both. Both in terms of the communication messages and all of this in the risk communication, it should be developed at the central level. But in terms of the dissemination and the reaching of the people through the decentralized communication and the delivery platforms, so that it should combine the both systems, but within the health communication system. Over.
Thank you very much.
I
Thank
can
you.
also add one point here. I think Elnur has just reminded me that how important it is to address risk communication within the overall health system's purview. And when we talk about that, we also need to look at what is the healthcare workforce capacity to deliver the sort of risk communication messaging, understanding the social perceptions, needs of the evolving scenario, etc. So there is a fair bit of understanding about risk communication as a science globally that we need to adapt and use for India. And I think moving forward, it's a very important pillar which needs to be further built. Risk communication workforce needs to be strengthened. We need to understand what kind of competencies we need to deliver, also for functionaries on the ground, but also how communication cuts across different ministries. Today, it's not just the health ministry, which is engaged in risk communication and stigma reduction work. A lot of line ministries are also contributing. So it is just not the health business or the mandate of the health agencies alone. And therefore, there is a lot of need for coordination also within different actors, agencies, and sectors for the purpose of risk communication.
Thank you very much, Dr.
Thank you, Dr. Ritu, and thank you, Avinash. Thank you, Elnur, for your input. I'm going to take another question from Dr. Avtar Singh. I'm unmuting you, sir, if you could accept that request. Sorry, I muted you again by mistake. I'm going to unmute you again. Dr. Avtar? I keep unmuting you as soon as you, one second. I've made you the co-host. Just unmute yourself now. Are you there?
Yes, ma'am.
Yeah, go ahead and ask your question.
Now, yes. Listen to me.
Yes, we can hear you.
Okay, ma'am. Ma'am, I have no any queries.
Okay, thank you.
Okay, ma'am. Thanks, ma'am.
Okay, all right. Let me take a few questions which were there in the chat.
Yeah, I think the chat box, please take a few questions. Yeah.
Right, so there are these two questions that I would actually like to combine. One of them was that, can you elaborate on indicators for measuring effective RCCE? And I think the second part of that question could also be, how can we assess the reach, acceptability, and impact of RCCE strategy? These are two separate questions which I think can be addressed together.
Mm-hmm. Okay, so Elnur, do you want to go first or shall I?
Ladies first.
Okay, great. Thank you. So I think it's, and I mentioned it in one of my slides as well, that this is an important area of work as well, that what one is doing in terms of risk communication also gets monitored and tracked. And there are a vast array of indicators that help us to do that. As I mentioned, that this is about making sure that you do social listening, you understand from the media what are the perceptions on the ground. We look at tracking what questions are coming from the communities. One can do surveys, as Elnur had also shown in some of his slides. So there are these various channels and mechanisms available for monitoring and tracking of RCCE interventions. And again, ministry is also trying to work closely with partners to see how many states the interventions are currently ongoing actively for risk communication, how many people are being reached, whether it's through webinars or trainings or through, through the social media handles, what is the reach, what is the uptake, how many people are, being addressed. So all this helps us to better understand how, the whole business of risk communication is actually panning out. and how we can further use that information which is coming from the field to better inform our interventions. While one does that, I think it's also important for us to, as I mentioned in my presentation earlier, that this pandemic has also opened up a lot of avenues for fake news information. So also tracking that helps us to better understand, what is it that people really are looking for in terms of information, how reliable and what kind of sources are being used as reliable or trusted sources for information, and how ministry can intervene. And a lot of multiple messaging, consistency of messaging across channels, how this can be maintained also helps us to better help navigate the complex environment of the evolving pandemic and the whole RCCE itself. For instance, when we trained all the 1075 telecallers for the purpose of stigma reduction, we were trying to understand. So now that we have trained this whole batch, how can we use some sort of indicators for us to understand, that if there were to be instances of stigma, will the caller be able to address it? Will the concerns of the person who's calling be navigated well? So one then builds onto the whatever pieces of work that one is doing in terms of the M&E frameworks as well. So these are again evolving parts of the work that we are currently doing with the Ministry of Health and other partner agencies. But again, this is one of the missing pillars as well, as I was informed today, that even in the regional strategy for risk communication, this is currently a weak area and that needs further strengthening. So this is something that we need to also understand from how other communities, other member states are working in terms of RCCE, M&E frameworks, and how we can build this better. Over to you, Elnur.
Thank you very much. Once Dr. Ritu, she talked about what might be the indicators. I believe that I will bring a few indicators that, for instance, those indicators that associated with the communication in itself, and then associated with the risks. So what is a communication we talked about? It's about the knowledge, attitude, practices, and the behaviors. And another one, indicators might be associated with the risks and enabling environment that create the risks. So let me to give you a few examples. That number of the people reached with the RCC interventions. If we say that over the billion people reached with the RCC interventions, we can say that the number of the percentage of them remember the key messages, at least 3 key messages for the last 1 month. So with this one, we see that it is a reach, but at the same time, we see that how many people remember. Then we may ask a question that what is the preferred channels of communication you heard about these messages. So that, and then moving to the, if we are asking about the risk perception or the risks in itself, it's about for instance, percentage of the people, they believe that if they would not wear the masks, what would happen? So if they will not have the physical distances, what would happen? Or the certain, the risks that percentage of the people believe that they are neighbors practicing the wearing the masks or following the physical distance. This will tell us that what is the percentage of those people who have been reached and has named the messages they are already practicing. So that when we're in a summary, if we want to elaborate about the indicators, we need to look at the enabling environment first, communication second, and the risk third, in terms of to define the framework for the outbreak risk communication indicators. And in terms of the assessment, we already mentioned that if before to start even think about the RCCE, we need to think about what are the evidence we have to start the risk communication and community engagement interventions or the strategies. so that research and assessment shouldn't come at the end. Research and assessment should start from the beginning. And there are a number of the assessment tools that can be elaborated in this. The formative research might be in the beginning, and then at the end it might be the impact surveys and the let's say the in between, it's the implementation monitoring, so that the overall system of RCCE research monitoring and assessment, it should be part of the risk communication and community engagement programming. Over.
I think one of the other things one also needs to do is document some of the best practices that are even emerging in terms of communication strategies, and then how do we share that across different channels, platforms, and how to avoid even duplication of the resources, what partners are developing, and how garnering collective support around RCCE itself lends credibility in terms of the impact of the intervention itself. So again, those are also some of the ongoing pieces of work that help us to better understand. For instance, when the lockdowns get eased up, how people are actually going to follow the physical distancing that we expect them to do, how workplaces are going to be enabling that people are able to follow hand washing and some of the interventions. Again, so as Elnur mentioned, that this is about enabling environment, this is also about understanding the risk and risk reduction practices. But as I also mentioned, it will also hinge on how individually and collectively motivated we are as a society to ensure that these behaviors can be adopted, and how feasible it is in different settings to do so. So then definitely research does help for us to better understand how things can be made possible in different settings. Over.
Thank you, Dr. Ritu. I know we have crossed our time, but there is one more question that I would like to take, and then that came in the chat box, and then one from the participants. Is that okay?
Yeah, go ahead, please.
Okay. So one question that was in the chat box in different forms, and I'm paraphrasing here, is that there were concerns about how does information and effective communication reach out to people with disabilities, especially the one with maybe visual impairments or hearing disabilities. How can effective communication reach out to them? So could anybody comment on that?
Okay, so as I said that in my presentation, that it's really important that as part of the overall RCCE package or the plan, there is enough thought which is given to how we can reach the most marginalized and the most needy. And we do understand that there are some high-risk groups, etc., for which information access could be an issue. And therefore, we are counting on the frontline workers, the volunteers, the civil society partners, and the whole business of creating COVID Academy comes to the fore, that here is an opportunity where CSOs, NGOs, other volunteers, groups can come and play a very active role. Let's all assume the responsibility that we have collectively as a nation to contribute towards the COVID-19 response and make sure that those that are most in need are able to get this sort of information. Again, a lot of work is being done by the ministry also in terms of translating many of the messages into vernacular languages, ensuring multimedia approaches to delivery of these messages, making sure that these are delivered through a wide variety of platforms. We do know with the demands of people having to be indoors during the lockdown period, a lot of information has been through digital and other forums. A lot of trainings have happened on digital forums. And I think COVID Academy is also an example of how we have been able to reach a much wider audience than we would have been able to reach otherwise. So I think let's utilize all the opportunities that we have. We welcome those NGOs who have joined us today to help contribute towards this noble work. it's a collective fight and we all have a role to play. Over.
Thank you, Dr. Ritu. I am going to unmute Mr. Ashish Dara. I've sent you an unmute request, so did you receive it, Mr. Ashish? Okay. I think Mr. Ashish is not there. Mr. Kingshuk Saha, I'm going to move to you now. Mr. Kingshuk?
Yeah, hi. Hello. Hello, madam.
I think Mr. Ashish and Dhara have been
Yes, ma'am. Ma'am, I'm Ashish Tara. Can you hear me now?
right. So 1 second, we will first take the question from Mr. Ashish and then we will take the question from Mr. Kingshuk. So Mr. Kingshuk, please stay on standby and hold your question. Mr.
Sure.
Go ahead with your question.
Hi. Yes, ma'am. Good evening, ma'am and sir. Actually, my question was that basically for Indian slum areas, that people who are living in the slum areas, so how far the social distancing will work for them? Because in a small room, 10 or 15 people are living in same place. So how far it will work? If you kindly.
Yes. It's a very legitimate question, and it's a question which is being discussed in several circles within the government also, and additional interventions have been thought of to ensure that people who are in densely populated slum settings, how they can be protected. And by and large, we know and understand that there would be challenges, but there are also additional strategic, policy approaches which are being directed to make sure that people wear face covers where it's needed, that risk communication messages are displayed at the right locations, and there is hand washing facilities available, where there are community toilets which are used by several people, that how good hygiene practices can be encouraged to make sure that people can follow risk reduction behaviors, installing community hand washing stations, and making sure that all the interventions are then delivered. So we do understand there are challenges, and which is why some of these settings we are seeing a much larger surge of cases. But again, this is an ongoing area of work where it's very important that while the health interventions are being delivered, also the essential interventions, especially in hotspot areas where medicines have to be distributed or food has to be distributed, also happens in a way that the frontline workers, etc., also people who are involved, the police personnel, those who are involved in delivering the sort of response to the ground in the hotspot areas, their personal safety is also ensured while some of these interventions are delivered on the ground, while making sure that the communities are protected. It's also about educating the families about what they can really do within the circumstances that they are in, educating them about early healthcare seeking behavior, making sure that the COVID care centers are located in nearby areas only, so that people do not face the difficulty of having to go too far, or they are too away from their families, etc. So many differential strategic approaches are being followed, and a lot of training is also going on for ensuring that these can be effectively delivered on the ground. Over.
Thank you, Dr. Ritu. Mr. Kingshuk, you are unmuted. Please ask your question.
Yeah, thank you. First of all, I'd like to thank Sphere India, UNICEF, and WHO for coming up with this sort of meeting, which is very crucial in nowadays, because exchanging of thoughts is important. Coming down to my question, it sounds like a little stupid, but this is a very common question nowadays. Sounding Corona is not affecting much, whether sounding COVID-19, it's a heavy word to us. Now, my question is, what is the difference between getting affected by Corona and the COVID-19? Is like Corona affected? Like I am a like carrier, and COVID-19 means I am already a patient. Is it like that? Could you please clarify on this?
Okay, so maybe I'll clarify for the purpose of the audience here that the disease is called COVID-19 and the virus is called SARS-CoV-2. And let's not confuse between the two. So when we talk about COVID-19, we are talking about the disease. And when we are talking about the virus, we call it SARS-CoV-2, severe acute respiratory syndrome virus 2. Since in the beginning, when the virus, when the disease was first evolving, etc., there was some time in terms of even the scientific nomenclature, being ascribed by the World Health Organization. And therefore, in the beginning, this was called NCOV or novel coronavirus. And still we do, in many colloquial languages, we still talk about coronavirus itself. But what we are now moving on steadily as a scientific community is to talk about COVID-19 as a disease. So let's stick to that. Over.
And may I come in just?
Yes.
In the beginning, that's when I've been introduced. I'm a social linguist. So that's which means that the communities, they are taking the connotative meaning of any word, and they tend to interpret and based on their understanding. That is why when we are talking about, that is the one of the reasons how the messages means in a languages, they are changing to the context that the people they live in. Therefore, we need to have a stronger evidences, data on how people perceive the risk for us to communicate about the risk. Maybe we will not talk about we will not promote about the COVID-19, but we will talk about the disease. And India, it has its own experiences from the states, from the districts, from the block level, in terms of, let's say, what we are communicating with the TB before, what we were communicating with HIV before, it is not, it might not be applicable to the COVID-19 or corona or novel coronavirus and etc. So that's for risk communication, we need to understand in which language the people they speak, how they understand, and which frequency they're communicating about the risks. Over.
Right.
So when we did ask this question in one of the surveys, we did ask this question to many people, whether they think, COVID is a disease or coronavirus is a disease. So there is a fair bit of mix up between the two. And we do understand that, and as Elnur has highlighted, that because of the fact that people have, adopted coronavirus as the virus. So therefore this perception continues. I think regardless of whatever whatever the community adopts, I think finally we do have to come down to what is it that we can do to prevent the COVID-19 disease, and what everyone needs to do, what is individual responsibility, what is collective responsibility.
Right.
I think let's focus on the prevention aspects of it, and I think that will be most important.
Okay. I'd like to thank all the faculty members for staying back even after the time has gone. I'm so sorry, but this is an important last request that I have. There's this last question from Mr. Javed Tak. He had his hand raised for a long time. So Mr. Javed, please ask a question and just make it really quick so that we can wrap up after this. Thank you.
Yeah, thank you. Thank you very much. I am Javed from Jammu and Kashmir. And I have a concern for the persons with mental disabilities. When we found that a mental disabled person is 40 years old, he has completely lost his parental support. And these persons are uncared and unprotected, always roaming around and seen in the public places, and people are exploiting them. Maybe sometimes they would be the carriers of these viruses and they are not even tested or checked. What can you suggest? The local community support is missing somewhere, and we were here asking that during risky situations there should be some local support system, and maybe we can multiply so many ideas or models, just like Baitul Mal or Zakat is in the Muslim communities. If we can have such support system in the communities, maybe sometimes we can help out during risky situations and reach larger amount of population. But here is the question regarding the support system for the person with mental disabilities who have now no support system at all.
So it's a difficult question to answer, but I will try and unpack the various aspects of it. See, first of all, I think it's very important for us to understand that in the context of COVID, because of the lockdowns, etc., there has been a disruption of even the essential healthcare services to some extent. And now, of course, there are these essential health services are being resumed, immunization, some of the other resources are being extended to the communities, and many of the essential systems, government facilities are opening up. But what is important for us to understand is that there are other diseases, whether mental health or otherwise, that need to be taken care of. Somebody else was mentioning the other day that a lot of patients who need dialysis are not coming to the hospitals because of the fear of COVID itself. So we need to understand that COVID is not the only health, disease or condition that needs to be handled within the communities. There is a vast array of other health conditions, chronic diseases, cancers, mental health ailments, etc., that also need to be managed. And therefore, it is incumbent upon the state and the district health authorities to ensure that these services are made available. And a lot of guidance is also being given by the Ministry of Health at the union level about resuming the essential healthcare services, so that even in the context of Ebola virus disease in West Africa, we found that many more people were impacted because of malaria and other chronic diseases, much more than the public health emergency itself. So that's one aspect of it. The other, of course, is that what is it that society can do to provide help and care and comfort to people who may have mental health conditions. I think firstly, it's very important for us to also recognize that what are the symptoms of mental health conditions. I think everyone, including all CSOs, need to be cognizant of behaviors that could constitute as people who may need additional supportive interventions for psychosocial help or mental health or emotional well-being or some of these issues as well. And we are also finding that in the context of the lockdowns itself, some of the people are coming down with depression, anxiety, sleeplessness, excessive worry, feeling of loneliness. Many of these symptoms are also getting manifested because of the whole, apprehensions linked to COVID, but also having to be indoors, not being able to interact with others. So as I mentioned, that we are talking about physical distancing, but still the emotional connect needs to be there. So really the society needs to come together to support family and friends, and being connected to loved ones is also a very important factor as we move forward. This is going to be a long haul. We know that without effective therapeutics and with no vaccine yet in sight, the fight against COVID-19 is going to be a longer term battle, and therefore we really need to put all our collective energies together to be able to address this. As a society, how we can help others in need, show kindness and compassion is very important. We talked about empathetic listening and ensuring that we take care of ourselves and we also take care of those who are around us. That said, I think the concerned person that you are mentioning, why don't you as civil society come forward and support this gentleman? And let's start with ourselves. Let's build that consciousness as we move forward, that everyone has a role to play. Over.
Thank you, Dr. Ritu. We'll have to end the session now. So Mr. Prabir, I will have to not take your question this time, and I apologize for that. Thank you, Dr. Ritu and Elnur. I see Sid has left, but I would also like to thank Mr. Siddharth Sreshta for coming in and giving his inputs. I'm going to make very few administrative announcements just quickly, and won't hold you back for too long. To receive your certificate of participation for this session, please visit the following link after 24 hours, because we need some time to update our database. So the link, so the website would be www.sphereindiacovid19academy.org. I would also like to say that we are having another session, but on community engagement in the context of COVID-19, which is happening on Monday. That is 15 June from 11 a.m. to 12 p.m. Please feel free to join that session as well. The registration link will be up on the website by tomorrow. We will also send it to you by email. But in case the email doesn't reach you, you can always visit the website and go ahead and register yourself. If you have any queries, questions, suggestions that were not answered, or you would like us to take up any sessions, extra sessions you would like us to do, please do give us your feedback, good and bad, on COVID-19 Academy at sphereindia.org.in. So that would be all from my side. Have a safe and wonderful weekend, everybody, and please take care. Thank you, Dr. Ritu and Elnur, once again.
Thank you, Valerie, for organizing this session. And thank you, Elnur, for a wonderful presentation. And I hope we complemented each other's presentation as we moved forward. Thank you so much. And thanks for all the people who have joined us today. We do hope that moving forward, you'll be able to actively contribute. I'm sure some of you are already contributing to the risk communication, community engagement, stigma reduction front, but we would like a very active participation of the civil society in these endeavors as we move forward. Thank you very much.
Thank you very much, Valerie. Thank you very much, my dear colleague, Dr. Ritu, for the wonderful presentations. And thanks, first of all, it's the thanks to Sphere India and plus all these 224 participants and the 124 who left behind currently. And this is a great indication of the great interest. Thank you very much.
Thank you.
Thank you, everyone. Wish you a safe and happy weekend. Take care.
Thank you. Thank you. Bye.